One patient came with a history of extreme thirst, headache, frequent urination, nausea and vomiting, feeling very tired or weak, abdominal pain, fruity smelling breath, and rapid deep breathing. He has a history of type 1 diabetes, and this is the problem he came with. So, what will be the diagnosis? Yes, this is a case of diabetic ketoacidosis. Myself Paramita Chatterjee, Masters in Medical Surgical Nursing. Today our discussion topic is diabetic ketoacidosis. What is diabetic ketoacidosis? Which is diabetic ketoacidosis? First we know about what is diabetic ketoacidosis. Diabetic ketoacidosis is caused by a profound deficiency of insulin. This one is important sentence. Profound deficiency of insulin, and is characterized by hyperglycemia, ketosis, acidosis and dehydration. Four main character: hyperglycemia, ketosis, acidosis and dehydration. It is almost likely to occur in people with type 1 diabetes, but may be seen in people with type 2 diabetes. So this is diabetic ketoacidosis mainly due to the deficiency of insulin. And in diabetic ketoacidosis, four characters strongly present: hyperglycemia, ketosis, acidosis and dehydration. Then precipitating factor. When any patient came with a problem of dehydration and polyphagia, polydipsia, abdominal pain, nausea, vomiting, first we take the history. Which history? If patient have type 1 diabetes or type 2 diabetes. If type 1 diabetes, how long duration the treatment is going on, and which type of insulin patient may get, and which type of medicine patients are taking, and also if patient is patients maintaining all the precautions or all the it's adhered to this treatment schedules. Patient totally adhere to the treatment schedule. This much information firstly we will get from the patients or patients' relatives. If she or he continue to take the medicine or lifestyle modifications is maintaining or not, this type of history we must take from the patients or patients' relative. And second one is the infection history. First infection is pneumonia. Patient have any cough history, patient have any fever history, patient have any sputum production history. So we must take the infection history. First one is pneumonia, and second one is UTI, urinary tract infection. Patient may have burning sensations during urination, and also the cholangitis and pancreatitis history. These pancreatitis, cholangitis, UTI and pneumonia precipitated the diabetic ketoacidosis. First one is type 1 diabetes and type 2 diabetes. Type 1 diabetes and type 2 diabetes also precipitate diabetic ketoacidosis, and also the infection also precipitated the diabetic ketoacidosis. And another I is infarction. Patient have history of myocardial infarction, or patient may have history of severe cerebral vascular accident. So this much information we must take from the patient's relatives. And another I is inadequate insulin dose. Patient properly get adequate insulin dose. If patient not get proper insulin dose, patient may go to the diabetic ketoacidosis. If patient undiagnosed, much more time, patient not diagnosed properly, so this also precipitated the diabetic ketoacidosis. And poor self management. So 4I is important precipitating factor. First one is illness, I for illness, I for infection, I for infarction, and another I is inadequate insulin dose. And last one is undiagnosed type 1 diabetes and poor self management. Then etiology. First one is diabetic patient. If patient have type 1 diabetes history, this is the main causative factor for diabetic ketoacidosis. If patient may have infection history, pneumonia, urinary tract infection, cholangitis, pancreatitis history, so patient may have causative factor present, infection. So it may be the result diabetic ketoacidosis or inadequate insulin administration. Before we discussed, if patient not get proper dose of insulin, then it may last effect or last result is diabetic ketoacidosis. And drug history also, if patient may get cocaine, then it also induces diabetic ketoacidosis. Or last one is pregnancy. So infection, illness, inadequate insulin administrations, all the cases, one thing we notice that stress is increased. If stress is increased, then body energy requirement is increased. But here in diabetic ketoacidosis, what happened? Energy production is reduced. So supply and demand mismatch is here present. So these are all the etiological factor. Then we go for pathophysiology or mechanism behind it. Diabetic ketoacidosis, what mechanism behind it? So first one is insulin. Insulin is the main character. Insulin, glucose and ketones. Insulin is the main character, glucose is associate characters, and ketones the villains of this story. Ketones are the villain. So what are the role? Insulin, glucose and ketones to create this diabetic ketoacidosis script. What are the role? What role they play in that cinema, diabetic ketoacidosis? So insulin is the main character. What is insulin? From where insulin is secreted? Insulin is secreted from beta cells of pancreas. Insulin is secreted from the beta cells of pancreas. So if beta cells of pancreas is destroyed in autoimmune disease or any other disease, so insulin not released. If insulin not released, what happen? If insulin not released, then what happen? Our cells not get glucose for energy production, but this glucose enter into the blood vessels and blood sugar increased. So this is the fact. If insulin is not work properly, it will discussed more and more in that picture. In this picture here, one key is present, one lock is present. This is the lock, this is the key, which is held by one character. This character is insulin, main character of diabetic ketoacidosis. And here one waiting to see this picture. This waiting character is glucose. So this waiting character is glucose, and this character is helping character is insulin, who tries to open the lock through the key. So what story behind it? Insulin helps to transfer the glucose into the cell. If insulin not present, glucose not able to enter into the cell. If glucose not enter into the cell, cell will not able to produce energy. Okay, clear? So insulin tries to open the lock through the key. This is the receptor, insulin receptor. So insulin tries to open the lock through the key to help to transfer the glucose into the cell for energy production. This is the main story. If insulin not present, if insulin not work properly, if insulin's resistance is present, body does not sensitive to this insulin. In type 1 diabetes, what happened? The body either does not produce enough insulin or cannot use it effectively in type 2 diabetes. So So our body is much more clever. If insufficient insulin is present, if glucose not enter into the cell, then what happen? Then all the glucose enter to the blood circulation. In normal condition, glucose enter into the cell. In abnormal condition, type 1 diabetes, glucose not enter into the cell. So all the glucose stay in the blood vessels. So what happened? Hyperglycemia. This is the end result. When hyperglycemia present, body does not get proper glucose for energy production, then our body try to utilize other sources. If one is blocked, then it utilize the other source. What are the other source? These sources are fat. Body tries to break down the adipose tissue. This to get energy. So, if adipose tissues are break down, this process is called lipolysis. Through lipolysis, our end result is fatty acid. If fatty acid is released, then fatty acid goes to the liver. Here what happened? Beta oxidation. If fatty acid, so what happened? When body does not get energy or from carbohydrate source, then body tries to get energy from fat source. When it get energy from fat source, this process is called lipolysis, and through lipolysis the end result is fatty acid. When fatty acid is released, fatty acid goes to the liver. Here what happened? Beta oxidation. Through beta oxidation, the end result is ketones. And ketones are three types: acetone, acetoacetate, and beta hydroxybutyrate. So when ketones are excess, then what happened? Ketosis. When ketosis present in the body, what happened? Body metabolic acidosis. In metabolic acidosis, pH will be decreased less than 7.35 and bicarbonate level will increase. During that time, when body going to the metabolic acidosis, pH released, bicarbonate increased, then body tries to start compensatory mechanism. Again compensatory mechanism. What compensatory mechanism? In compensatory mechanism, one system is respiratory system, another system is renal system. Help there. In respiratory system, what happened? Hyperventilation. Through hyperventilation, carbon dioxide expels out from the body. If carbon dioxide expels out from the body, then acid expels out from the body. This is the one compensatory mechanism, and through expiration, acetones also released. If our smell is fruity smelling breath, then acetones released from the body because acetones has fruity smell. So in DKA, in diabetic ketoacidosis, we find out fruity smelling breath, which is called Kusumal respiration. So here one compensatory mechanism, another compensatory mechanism is renal system. What happened? Another ketones increased, another sugar increased. Ketones increased, sugar increased in the body. Body tries to expel out ketones and sugar from the body. Body tries to get rid of this toxic product, ketones and glucose. So not only ketones and glucose released from the body through urination, it also draws the water from the body. So more water released from the body through urination, through polyuria. And not only water draws out from the body, it also draws the electrolyte. So hypokalemia is present in diabetic ketoacidosis. So last one is dehydration. More water released through the polyuria. So dehydration is the end result, compensatory mechanism. So what are the signs and symptoms? First one is polyuria, discussed previously. Why polyuria present? To get rid of ketones and glucose, body tries to expel out through the urine ketones and glucose. So frequent urination is present, and after that polyuria and polyphagia means excess hunger. Why excess hunger? Cells are not get energy properly, cells are going to starvation. When the cells are going to starvation, our brain stimulate our bodies, send the message to get more food. So here hunger is present. Then polydipsia, excess thirst. During urination, more water draws out by the sugar and ketones from the body. So this is the osmotic diuresis, and through osmotic diuresis water is released from the body, and due to this reason body goes to the dehydration stage. So thirst present here, more thirst present here. This is called polydipsia. And another sign symptom is abdominal pain. Why abdominal pain is present in that case? Due to the electrolyte imbalance. Here hypokalemia is present, and due to hypokalemia abdominal pain will be occur. And another one is nausea and vomiting. Why nausea and vomiting is present? Due to presence of ketones. Ketones irritate our central nervous system. If central nervous system get irritated, it stimulate our vomiting center. So excess vomiting is present. And last one is hyperventilation. Why hyperventilation is present? This is the compensatory mechanism. Body tries to expel out carbon dioxide from the body, and acetones along with it also released from the body. So hyperventilation is present, and also tachycardia here present, and also hypotension also present. If acidosis is present there, then it may dilate our blood vessels. So hypoventilation is hypotension is present, tachycardia present, and tachypnea also present in diabetic ketoacidosis. So here is the schematic presentations of diabetic ketoacidosis. First one is beta cell destruction. If beta cells are destroyed, beta cells presence where isolates of Langerhans in pancreas. If beta cells destroyed, then insulin deficiency will be occurred. If insulin deficiency occur, what happen? Body tries to get glucose from other sources, adipose tissues and muscle. And if adipose tissues and from muscles are body tries to get energy or glucose, then what happen? First I discussed previously, if fat is burned, if adipose tissue from adipose tissue, if body wants to get the energy, then what happened? The end result is free fatty acid. Due to lipolysis, the end result is free fatty acid. And if free fatty acid is end result, then it goes to the liver. And in the liver, beta oxidations occur. And after that, beta oxidation, the end result is ketones. So ketones is increased. When ketones is increased, this is called ketoacidosis. And another mechanism here happen when the insulin deficiency occur. In that scenario, body release the catecholamines, epinephrine, norepinephrine, and also glucagon, and they tries to increase the gluconeogenesis and glycogenolysis in the liver. During gluconeogenesis and glycogenolysis, sugar also increased. If sugar is increased, then hyperglycemia. Here one picture is ketone increase, here another picture is glucose increase. If ketones increased and glucose entry, then body compensatory mechanism start. Kidney, what happened? Kidney tries to get rid of from the ketones and from the sugar, polyuria. Through urination, body tries to get rid of from ketones and glucose and draws the excess water from the body. Then volume depletion. If volume depletion happen, then polydipsia. So these are all the mechanism behind it, diabetic ketoacidosis. So today I discussed about what is diabetic ketoacidosis and what are the etiological factor and what are the predisposing factor, and also the sign and symptom and what mechanism behind it. So thank you.